Hi, my name is Elise Riley, and I lead a group of health disparities researchers at the University of California in San Francisco. Today I'm going to be telling you about some work my colleagues and I have been doing on the overall health status of HIV-positive, homeless, and unstably housed adults. I'm going to be paying some particular attention to just some of the social and structural factors that Greg Millett brought up earlier, and I'm going to be giving you an example that's more on an individual level, a local group in San Francisco, and with a focus on unmet subsistence needs. So the impetus for our work stems from the disproportionately high levels of health complications, morbidities, comorbidities, and mortality among impoverished individuals, particularly among people who are so impoverished that they don't have a place to live. Currently, in the United States, HIV is considered to be a chronic problem that many people are able to control with antiretroviral therapy. However, medical benefits have not been realized equally across populations, particularly among impoverished folks who have barriers to medical care, treatment, and adherence. With so many competing and unmet needs, my colleagues and I were wondering, we know that there's a lot of factors that are important, but oftentimes there's not a lot of attention to, well, which ones are having the most influence on health status and health outcomes? And if we have a finite number of resources, is there something that we can give to providers to give some indication as to perhaps what could we prioritize, knowing that we want to get to each factor? If someone comes to you and they have a lot, where could you possibly start? So our objective was to look at a variety of factors, look at them over time to see how things change, to see how much influence they had on health outcomes, and to then rank them in terms of how much effect they're having on the outcome. And to let you know that this particular analysis I'll show you is going to be restricted to just HIV-positive, homeless, and unstably housed men. In some of our prior analyses, we've seen that men and women experience some of these factors differently. And so I'll just be showing you our data on men and do a little bit of a comparison with our women's studies toward the end. So to answer some of these questions, we sent a mobile outreach team into the Tenderloin neighborhood in San Francisco. We approached folks in homeless shelters, free meal programs, and low-income single-room occupancy hotels. We invited folks to participate. We did screening, interviewing, and HIV testing. Everyone who tested HIV positive was invited to participate in our study, which involved coming to a community-based field site once every 3 months, where they were interviewed, had blood draws, and had health evaluations. We were interested in overall health status. We measured this with what's called the short form 36, or the SF36. There were two composite scores. One is an overall physical health status, and this was measured by mobility, pain, physical functioning. The other measure was mental health status. That was measured through social functioning, vitality, and general overall mental health. The exposures are of interest, or the factors that we thought might be influencing these outcomes. Again, these are social and structural factors. Socioeconomics. When we think of subsistence needs, we define that as sufficient access to housing, food, clothing, and hygiene needs. We also considered recent incarceration, drug and alcohol use, violence, social support, insurance status, adherence to art, and then CD4 cell count and viral load. So there are a lot of factors that we were looking at over time. In thinking about all of these factors over time, I'm not going to get into details, and if you're interested, you can ask me later, and for all of those methods geeks, I'm happy to detail a lot of this, but I'll just say we chose what's called a targeted variable importance approach, and what that does is it uses something called marginal structural models. It looks at data over time. It accounts for correlated data and all these complicated issues of longitudinal data analysis, and it lets us know how much of an influence each of those factors are having on an outcome. And then targeted variable importance allowed us to rank those in terms of how much effect they're having on the outcome. So we were able to enroll 288 HIV positive, homeless, and unstably housed biological men. Median age was 41 years old. Just under 40% had graduated from high school, and almost 2/3 were men of color. In the past 3 months, the median monthly income was $815, and this, as an aside, is in a city where the current median rent for a one-bedroom apartment is $3,100. 20% of folks slept in a public place, is what was reported at baseline. 26% reported having at least one unmet subsistence need. 23% used crack, and 9% used more than 2 alcoholic beverages a day. To give you a snapshot of physical health at baseline, the median baseline CD4 cell count was 349 cells per microliter. 1/3 of participants reported having current symptoms of chronic health conditions like diabetes and high blood pressure. Only 18% took antiretroviral therapy. So in those constellation of factors that I showed you a couple slides ago, of those 16 factors, 4 of them maintained strong effects on overall health status over time. And when we ranked them, I want to qualify this by saying this is a very special population. These folks are homeless, which means that there's more homogeneity in terms of income and unmet need, which is going to lead to some unexpected findings. First of all, the factor that had the strongest influence on overall health status was unmet subsistence needs. That is housing, food, clothing, and hygiene needs. Second came race. In this particular population, and this is a surprising finding that we can talk about later, Caucasian race actually predicted lower scores for health status. Having no sources of instrumental support, which was defined as having someone who could lend you money or give you a place to sleep. If you didn't have either of those, that predicted lower scores. And not surprisingly, as viral load went up, health scores went down. In terms of mental health, 35% of the population were depressed, 22% had recent manic episodes, and 16% had PTSD. Again, among those factors that I showed you a couple slides ago, those that maintain strong effects on overall health status over time, again, unmet subsistence needs. And now I'm talking about overall mental health. The first slide was physical health, this is mental health. Again, unmet subsistence needs had the strongest influence on overall mental health. Having a close friend or confidant, which is a measure of social support, using any type of drug, not having instrumental support, and having high adherence to antiretroviral therapy. One thing that I will point out that is different in this slide compared to the last slide, in the last slide, all of the factors that we ranked had negative influences on overall health status. In this slide, having a close friend or confidant predicted better scores, and also having high adherence to antiretroviral therapy predicted better overall health status. So in this population of HIV positive, homeless, and unstably housed men, our first take-home message was that only 18% of them were taking antiretroviral therapy. And while adherence to antiretroviral therapy and viral load had strong influences on overall health status, what we found is that they didn't have the strongest influence. What had the strongest influence was unmet subsistence needs. And briefly, I'm running out of time, but briefly, these results are very consistent with a study that we did with HIV positive, unstably housed women. And I'm happy to talk about some differences. There were some slight differences between studies later on. But the most important aspect of that study was that, as was true in this study, the strongest effects on overall health status were made by unmet subsistence needs there too. So with this consistency in findings and the strengths of these findings, our results suggest that homeless and unstably housed individuals will not fully benefit from advances in HIV medicine until social and structural factors are overcome. So I want to thank you for your attention. And again, if you have questions after our session or at lunch, I'm happy to talk to whoever's interested in these topics. Thanks.